Good evening. Welcome to City News. We're live outside St. Mike's Hospital here. I hope you never are, but can you imagine being in the tough predicament of having to call 911 because you're unwell, only to have the operator on the other end of the line decide whether or not to send an ambulance to you, or have a paramedic decide to bring you somewhere other than the emergency room? It's all possible under a new Ford government proposed bill. Consultations are underway on a proposed act that would see 911 operators do a lot more than just provide emergency advice and dispatch ambulances. It would task them with deciding whether or not to send that ambulance to the scene. Are they qualified to make that decision? Health Minister Christine Elliott says 911 call centers will be staffed with some registered nurses. Going forward, the plan is to have every 911 operator a registered nurse?
Not necessarily, no. Some of the people who are receiving those calls now may already have appropriate qualifications. They may not be nurses, but they may already have the required knowledge and experience.
Okay, but again, not to belabor the point, but you're not worried about these decisions being made over the phone. It just seems a little risky to me.
No, because we're going to make sure that the appropriate people are in place with the appropriate training to make these decisions.
The act would also give paramedics a lot of powers. It would give them the leeway to decide whether or not to bring a patient to an ER like this. They could transport them somewhere else if they decided to, a clinic, CAMH, or treat and release them on the scene. Though Health Minister Christine Elliott tells me a patient can still request to go to an ER if they so choose.
If they wish to go to the hospital, regardless, that's where they will be taken.
Just what makes the paramedic qualified to make that call? It seems to me like that's something maybe a doctor needs to decide on.
It depends on what the situation is. If it's within their scope of practice, then they are qualified to do it. But we need to make sure that anyone that is going to be providing these services does have the specified level of training.
OPSU, one of the unions representing some paramedics, wouldn't comment directly, but tweeted that its executive committee would, quote, meet on October 1st and 2nd and will be formulating a response. Some of the unions we spoke to today the paramedic unions were unaware of this situation.
Well, the regulations were posted as of today, so that they are going to be able to take a look at them and see what their thoughts are.
So you didn't reach out to paramedics before today?
There have been extensive consultations in the past. Whether they knew that it was coming out today or not, right, I don't know, but they knew that these changes were coming.
The NDP's health critic worries that not enough research is being done on this.
In some cases, it would improve patient care. On the ground floor, though, none of the homework has been done. They haven't made sure that all the EMS people have been trained, know when it is safe to bring to an alternate location, when it is not.
Public consultations on this will be ongoing until the 6th of October. Some of this was outlined in the spring budget. Of course, it's all aimed at tackling the big hallway healthcare crisis that's plaguing hospitals right across the province.